Namaste. I, Javian Dr. Shama Khatri from Faculty of Physiotherapy and Diagnostics. And today in this video, we are going to talk about a bioengineering topic named as Hkafo. Hkafo is hip, knee, ankle, foot orthosis. It is an orthosis whose components stabilize or lock the hip, knee, and ankle. The typical HKFO is a pair of KFO linked above the hip with either a pelvic band, lumbosacral orthosis. The hip section provides significant stability in the transverse plane, and if the hip joints are locked, also provides sagittal plane stability. The components of HKFO include HKFO is the extension of KFO which contains AFO, knee joints, two upright calf bands, quadrilateral thigh section, hip joint, pelvic band. The components of AFO are metallic or plastic. Metallic AFO components are proximal calf band, two medial or lateral bar, ankle joint, two straight up. The fabrication process of plastic AFO. Step 1. Creating a negative plaster mold to of patient lower leg and foot. Step 2. Cutting and removing plaster mold from patient. Step 3. Pouring liquid plaster into the negative plaster mold. Step 4. Mo- Molding the positive plaster cast. Step 5. Molding the HDPE plastic. Step 6. Removing and cutting the plastic from positive cast. Step 7. Finishing the plastic shape. Step 8. Fitting the patient. Two upright medial and lateral attached to the drop block knee joint from above and below and connects AFO and lower thigh band respectively. Straight set knee joint allows knee flexion and prevents hyperextension. It is used with drop block, which is a wedge-shaped metal piece that is placed on upright bar. When knee extends, it drops over the joint and locks it. Width of the knee joint is anatomical knee width plus 10 to 12 mm. Quadrilateral thigh section. The quadrilateral thigh section is designed to permit partial transfer of the patient weight through the KFO. During stance phase, which is made of HDPE plastic. This brings more effective balance to the patient's gait as a resultant stance period. Hip joint. Hip joint is attached to KFO, which allows flexion extension only. Movement of hip with a uniaxial hip joint with drop lock, which is locked during walking. Distance between knee axis to greater truncator is measured. Hip joint is placed on the lateral side of brace till the axis of hip joint is at the measured distance from knee joint axis to greater truncator. Hip joint bar attached to knee joint with bar with nails. Pelvic band. A pelvic band which is padded rigid steel band extending posteriorly and laterally which is fits between iliac crest and greater truncator. In front of In front it is fastened with a soft velcro or buckle strap fastener, or the lateral side it is attached to hip joint. Measurement of pelvic band is length of the pelvic band equals to circumference circumference of the pelvic level ASIS to ASIS distance plus 50 mm. Cutting of excess length of pelvic band is required equally from both sides and bending is done. Indication is bilateral HKFO designed for standing and ambulation in adults with paraplegia. It provides the paraplegic patient who has a complete neurological level at L1 to lower with a more functional and comfortable gait. The reciprocal gait orthosis is a HKFO that use a mechanical system that connects the two sides of the breast. Isometric bar, double cable, single push-pull cable system. Components are AFO, knee joint, upright, thigh cuff, hip joint, pelvic band, cables. The cord is suitable substituted by a pelvic band attached to the posterior surface of the molded thoracic section. Thoracic strap. In an RGOs, the hip joints are coupled together with cables, provide mechanical assistance and extension, which is preventing stimuli bilateral hip flexion. As a step is initiated and hip flexion takes place on one side, the cable cupping includes hip extension on the opposite side, producing a reciprocal walking pattern. Forward stepping is achieved by achieve hip flexion, lower abdomen muscle using two crutches, and NRGO paraplegics can ambulate with a 4-point gait. A walker may also be used. Hip orthosis may be prescribed for isolated problems in the acetabular region, which may be the result of dysplastic disorder, traumatic injury, surgical procedures. Orthosis in dislocation of hip joint. Once reduced, a total hip can be stabilized with orthosis until the compromised soft tissue heals and creates squarening around the joint. Posterior dislocations, anterior dislocations, pediatric hip orthosis, developmental dysphasia of the hip joint, leg clave Pathy's disease, cerebral palsy, lower limb weakness or paralysis associated with neuromuscular disorders, spinal cord injuries. So this was all about the HKFO. If you have any queries related this video, ask me in comment section. I will try to resolve that. Namaste. खुश रहिए. This video is powered by digital version of 2.0 Jyoti Vidyapeeth Women's University.